Sarah Walker. I major in psychology, and this is
Mariella. I'm an occupational therapist, and I'm doing my second bachelor in psychology here at UNF. And we are talking about dealing with puberty.
Now, we understand that puberty can be a very uncomfortable topic, but it is very important to discuss with your children. And in simple terms, you can think of puberty, it's simply the transition from childhood to adulthood.
And this is not only a change that happens like in your body, but also society see a child in a different way than society sees and treat an adult. So it may bring a lot of difference in life, the entire demand of life for kids and adults.
So it is really important to talk about. I know it can be uncomfortable and embarrassing, but your children need to learn these things, and it's perfectly natural and normal for your child to undergo changes on the way to becoming an adult. And it helps them make better choices later in regards to their sexuality, to prevent unwanted pregnancies and sexually transmitted diseases.
So we're bringing a quick video for you to simplify a few things that can happen, some issues we can address.
Young people with disabilities may have special needs in a range of different areas, but in all likelihood they are going to go through pubertal changes at the same time as everyone else. And the range of pubertal changes we're talking about are both physical changes, but also the emotional changes and the development of sexual interest.
When Andrew went through puberty, that was very hard. Because he did not understand what was going on with his body. How do you explain it?
Basically, Tash was a little girl one day, and within a couple of weeks she was fully into puberty. It was such a shock for her, and she had this amazing bodily growth very quickly. If it's hard enough for regular children who can express themselves and do understand the world to cope with their feelings and their fears and their anxieties and the confusion, then you can imagine how frustrating and confusing it is for an autistic child who, cannot express themselves, doesn't understand the feelings.
When I went through puberty, I didn't know what it was all about. It wasn't explained to me, and I didn't, again, comprehend what it was all about. So, for me, it was just enduring pain, and trying to comprehend why breasts grow on women and why men become like they do. It's very difficult for a person with ASD to comprehend puberty.
Young people with ASD are often anxious about changes and can get more anxious about things. Therefore, talking about puberty before it happens, warning them that these changes are going to happen, making it quite clear that asking questions is fine. There's no question that will embarrass me, is one of my lines. And it depends on how your child likes to learn. If reading a book is going to be the best way to talk about your body is changing, but you can likewise find sites on the internet that talk about bodies changing. So adapt to what the best way of approaching things are from your child's perspective to tackle the issue.
When Alex started going through puberty, it was quite funny because he kept saying he wanted me to take him to the doctor because he wanted to get his voice fixed because he didn't didn't want it to go low. And I think because deep down he knew it, that you can't stop it, but he was trying to, tell me that he didn't want it to go lower. And I said, look, there's nothing you can do about it. Your voice is breaking and that. So that was probably the first thing that he started commenting about. He did comment a few times about, not wanting to get hair in different places, but, I just sort of just say, no, everyone gets it. There's nothing you can do about that.
We did experience quite an aggression. She really did stop expressing herself in any which way. She became so anxious and so frightened. We had to rewind the clock and go back to lots of visuals.
One of the challenges when you're involved in looking after young people with disabilities is ensuring that what you've just explained has been understood. Now, that's actually an issue with all young people. It's very easy for me to slip into language that they don't quite understand. Likewise, as parents explaining things. And so the tactic of, I've just said an awful lot to you. Can you explain that back to me, just so I've understood, so that I know that you've understood what I've said? And also saying, we just talked about an awful lot of things then, and I don't expect you to take it all in one go. I'm very happy for you to come back, and we can go through the whole thing again whenever you're ready.
Children need to be reassured, that they're developing hair on their bodies, it's quite normal, or it's a bit slower in them than in others, it's quite normal, and it frequently is. They're more likely to be a late developer than an early developer.
The physical changes, the hair, all of that, that hasn't fazed him or worried him at all. The behavioural changes, all we've really seen is that he has been, I guess he was being a bit, what we call mischievous, and a bit of pushing the boundaries and being a bit non-compliant, which is so not James.
Andrew became aggressive and he lashed out. He lashed out at the people around him, he lashed out at me, he would scratch, he would bite.
For young men, of course, they get large doses of testosterone in their body, their muscle mass picks up, their bone mass picks up. So parents need to manage these by providing strategies and talking about these to the child before, saying these are the kinds of changes you can expect. These are the kinds of ways we expect you to behave. If you're going to lose your temper, this is an appropriate way to get angry. This is an inappropriate way to get angry.
The way we approach it is that she's just a teenage girl and she's going to throw at us so many things that teenage girls throw at us. We saw her move from childhood into puberty, which was quite sudden, and there was amazing differences in her behaviour. And it was easy for us to identify because I have the older girl. I think I'd be very confused if I didn't have the older child as an example.
It's typical teenager type of thing. So we've seen what, you see in a typical teenager, and sometimes you've got to think that way. You can't think it's all about autism. So you've got to think about those normal things that they go through.
Alright, so what typically happens to girls, don't panic if you see your daughter go through these body changes. It's perfectly natural. Typically around the ages of 7 to 14, you might notice that, her breasts are getting bigger, she's starting her period, she's experiencing cramps, hips tend to grow wider, hair grows in unusual places throughout the body, and their sexuality arises. They might end up touching themselves, and this is a situation that you really want to handle with delicacy.
And it's going to happen. And we gotta be prepared. We gotta face this situation. There's no way to not just pretend it's not happening. So what do we do?
Well, we can start by buying bras. Talk to your child about bra sizes and buying the right fit. Teach your child how to use tampons, pads. It might help also to, Mariella came up with this, buy a calendar and teach your child how to keep track of their cycle. Also, teach your daughter with autism how to express the pain of cramping. Sometimes it's difficult for these children with disabilities to express pain and address it with proper pain medications like ibuprofen or any other over-the-counter stuff that you can get, Midol. Teach your daughter about shaving if that's part of your culture. Preventing pregnancy and safe practices, birth control. These are very important things to talk about with your daughter as early on, just to make sure that they don't have any accidents later on in adulthood, and that they're well aware of these things.
I think this is kind of situation that it varies from family. I don't think it's like I think it's the most, let's say, tailored intervention that could be, because it's not like a potty training that everybody goes in the same way, or it's not something that a teacher implements in the classroom for everybody, because each family has its own way to deal with this, their own beliefs, their own way to deal with sexuality. Some families, when for instance have their daughters like shaving armpits, some don't. So it's, we gotta talk a lot with the family and figure out what they want for their kids.
So now these are interventions that are particular for daughters who have autism. So one good way to prepare your daughter so that she doesn't just wake up one day and there's blood in her underwear and freak out. So you can teach girls what to expect by putting red food coloring in their underwear to show them what it's going to look like so that they're prepared for when it happens.
Yeah, well, those are some like ideas we found to deal with this situation. Most of them are like to prepare in advance and tell the kids what's gonna happen. Depending on the family, if you have like a situation where your kids can see mom or the sibling sometimes naked or together in the shower or going to the bathroom together. Some families don't do this, don't agree with this, some do, but you can like show this is gonna happen. It's easier for a man like with the hair growing in the face and shaving. This is much easier for men, but for girls, we're more intimacy. So, but they should find a way to anticipate this. For the girls, this is very important. So those are some.
So these are some suggestions. The last one I like because it kind of makes it more positive. So planning a celebration party for when she starts her period, just to make growing into a woman more exciting, and teaching her that it should be celebrated. It's a good thing. So
the idea behind it, you shouldn't make this like a bad thing.
Yeah.
It's a normal thing. And of course, boys and men, they're way more simple. You can say, I dislike.
Yeah.
It's pretty much.
So boys around the age of 13, basically their voice changes. They grow more hair. They have muscle growth. Sexuality arises. It's pretty simple.
And also the same thing to talk to boys, the way you talk to girls. If you can create this open talking, not making this like a big deal. We have some interventions.
So basically, we want to treat this with delicacy and be very gentle We don't want to overreact or underreact. We don't want to make them feel like this is a negative thing. So we like use a calm voice. We don't yell. We just explain very clearly what is happening and that this is normal. And we just explain that this is a natural part of growing and becoming a man.
This is not easy. I guess it's not easy for the families, for the parents, and in any situation in general when you deal with any kind of kid growing up. So we're bringing some tips.
So your child will probably end up touching himself. This is a normal thing. And it's best when you catch him doing this, which you probably will, it is best to react calmly. If he is doing this in public, just gently, move him to a private area and just explain the appropriate locations for him to do this, like in the bedroom. Just treat it with care.
About shaping this again, if you have a father at home or an older sibling that can teach step by step, the same way they would teach how to potty train or do something else.
So this is just for the parents. Before you can effectively communicate your values about sexuality to your children, you need to know what you believe in and why. Go ahead. You are the main educators of sex for your son and or daughter. Whether you're comfortable or not, wouldn't you rather they get factual information from you than to follow a classmate's or friend's advice? And there's a website for you to look for more information on that. You must be askable. So you want to be approachable to your child. You want to be prepared for any question or incident that involves your son or daughter's sexuality. Always say, that is a good question. You can decide to answer the question immediately or say, we'll discuss it when we get home. But don't be like, don't ask that, because that's negative. And we want to just highlight that we want to approach this in a very positive manner. If you answer with a positive tone, then your child will continue to ask questions. And you want that, because you want to make sure your child gets the information from you and not from the internet or a classmate or anyone that doesn't have the information. Also, remember to answer the questions simply and directly. Don't give too much information to your adolescent. Children are not perfect. They make mistakes, and it's up to us to turn their mistakes into lessons. So these are some sources that you can use. They're this is where we got most of our information. I think you'll find them very helpful.
Because we never know what kind can come as a question or as a situation that your teenager brings to you. Sometimes we, as a parents, we are not prepared, so they're a resource to help us. So this is what happened to boys and girls, because adolescence, as I said before, is a period of time that society demands differently. And this is something that usually kids with autism have an issue addressing. It's a social time in life, and they struggle with that. They don't understand very well, and they don't frequently engage in social life out of school as much as other kids. So some kids might have impaired executive function, what adds a little bit of on top of that, in kids with autism spectrum disorder, the cognitive flexibility is the standout problem for them and seems to bring a problem as they get older, and this is time of life that they need this flexibility because of all the change that they are facing. So they can face bullying, they can face social isolation, and where you get everything?
It's cut off at the bottom.
So we should teach them some social skills, help them with this as much as possible. And I found it very interesting that some special interests,
The special interest common to autism can be an escape from social interaction if a teen occupies himself solely with his favorite topic. But if used correctly, those special interests can be a way to connect with other people. An interest in gaming, for instance, is often a way for teenage boys to connect with one another. Dr. Keefer.
and try to find resources to feel that they belong to a social group or something. This is the idea behind that. And also in school, school demands more, and kids are expect to understand things faster, and they don't have the kind of help they have when they're in kindergarten, when they're in elementary school, and things get worse. So sometimes they need extra help.
So that is the end of our presentation, and I hope it was beneficial and useful for you.